Good morning, my lord.
Good morning, Miss Stewart. Now, you have a witness for us?
I do. Giving evidence this morning, my lord, is Miss Maclean representing Unite Scotland.
Very good. Good morning, Miss Maclean.
Good morning, my lord.
Right, we've got some questions, or Miss Stewart's got some questions for you, so I'll ask her to start.
Thank you.
Are you ready, Miss Stewart?
Can you please, first of all, tell us your full name?
Hello, my name's Alison Maclean.
And you provided a witness statement to the inquiry, is that correct?
I did.
And my lord, for the benefit of the transcription, that is reference WT0249. Miss Maclean, you're the regional officer for Unite the Union Scotland, or Unite Scotland.
Yes, I am. Yes.
And you've held this post since 2006. I understand you're currently the lead officer for education and have been in that role since 2013, is that right?
I have education in relation to higher and further education, the university and the college sector, and within Unite, the education sector is managed differently in regards to the schools sector, the local authorities sector.
Thank you very much. I want to ask you questions about further and higher education, and also some questions about hub schooling, which I understand you've had input from colleagues to allow you to answer that. Yeah. Thank you. First of all, can you tell us a bit about Unite Scotland in terms of its aims and the composition of its membership?
Yes, Unite Scotland are the biggest union in Scotland and Ireland. We represent about 1.4 million members and about 152,000 members in Scotland. We support members across multiple sectors of the economy, including education and other sectors such as construction, finance, public sector and many other sectors. The aims of Unite are to provide support and representation to our members to help them every day in their working lives, to undertake campaigning and improve their terms and conditions. And part of my role is also supporting our workplace reps, our shop stewards, who are pivotal to the work that Unite do across the whole of the UK. And my role is to help and support them within the workplaces and to grow our union and make it a strong union.
Thank you. And in terms of the members who work within education, what sorts of jobs do they have? First of all, I can take your area of expertise, the further and higher education sector.
So a variety of jobs. Predominantly Unite are the union who represent support and professional services staff, and the support staff tend to fall into those that work in the lower grades within the college and university sector. So that is cleaning staff, facilities and typically janitorial type roles, security staff, technicians. We've got a large cohort of members who are technicians within the sector. We also have members who work in IT type roles, admin type functions, but predominantly our members are based and work across the estates and campuses within the university, providing that kind of back office support, if you want to put it that way, and do the roles that maybe aren't always visible in terms of the operation and the successful operation of the universities and the colleges.
Thank you. And just in terms of those who work in schools, because I'm going to ask you a little bit about hub schools and their staffing and their operation. In terms of Unite's members who work in early learning and in schools, what sort of roles do they fulfil?
So, I mean, it's fair to say, I think, within that sector in schools that Unite are not the predominant union, but we do have members that work in support type roles. So again, janitorial, cleaning roles, catering roles, and that is another role in actual fact that a lot of our members do within the college and university sector. I should have said that. We've got a lot of staff that work in hospitality and catering type functions. And we also have members who are in support for learning roles, assisting teachers within the classroom environment.
Thank you. And the other cohort I wanted to ask you about are the members who work at SQA. What sort of roles do they conduct within SQA?
So Unite are the largest union within the SQA, and we have got members who work across every single level. So from the most junior members of staff, so again they would be staff that work in kind of janitorial facilities right roles right to the most senior heads of service. We've got a large cohort of members within the qualifications development area, so typically qualifications managers, qualifications officers. We also have a large membership within the accreditation and regulation function within the SQA as well. And their role, you know, is directly in relation to, you know, working with teachers, working with centres, looking at exam procedures, for example, and then again, you know, all of the support type function that sits behind the SQA. We've got members that work in IT and those kinds of areas as well.
Thank you, that's really helpful. You've spoken to us a bit already about the aims and objectives of Unite, and a little bit of that included part of your own role, but I wonder if you can give a bit more detail of what your current role with the SQA, I beg your pardon, with Unite involves.
Okay, so I've been a regional officer with Unite the Union since 2006. I've worked in a variety of sectors across that time, and currently I am the lead officer for the education sector, and I also carry out the other part of my role is as a regional coordinating officer, and that is working with other officers with the union and supporting them in coordinating their work across the sectors that they operate within, and providing support to them and their reps, you know, to help them obviously grow the membership within the workplace and campaign on relevant issues. You know, as a regional officer as well, I am involved in negotiating directly with employers on terms and conditions of employment. I'm involved in supporting members within the workplace, whether that be through individual casework, and by that I mean if members need support for grievances or disciplinaries. Sometimes at officer level you will get involved in dealing with some of those more complex cases. I'm involved in supporting and managing disputes within the workplace. We've had an awful lot of industrial action within the education sector and other sectors within Unite. You know, kind of since the cost of living crisis, there's been an awful lot of disputes that have taken up a lot of my time as well. So hopefully that gives you a general flavour of the work.
It does. Thank you very much. The first aspect of impacts on your members I want to look at is the impact of the closure of institutions. And when we say closure, we recognise obviously that in further and higher education people can live on campus, and that people continued to work and in schools continued to teach. At paragraph 8 and following, you set out the impact of closure on those members working in FE and HE. And you explain here that because students were living in halls of residence at lockdown, members of staff continued working in person, and a number of them fall under the Unite membership. For example, you say security staff, janitors and cleaners required to go into halls daily to support students. Can you tell us a little bit about what sort of support was required and what sort of duties these people were carrying out in the halls? Yes, so the cleaners were obviously employed to operate within residences, and sometimes on campus, like Strathclyde University for example, they have got large residences on their campus, and a lot of the directly employed staff there have got a specific role working in what they call the village. And that would involve cleaners, security and janitorial staff. And what was happening was that a lot of the students were still there on site, living in their accommodation. Sometimes a lot of international students who at the time had no other support or network, and our members were there often as their first port of contact. So it could have been something as simple as a cleaner going in that day and being the only person that a student actually spoke to. And, you know, sometimes what was happening typically was that, the workforce were finding themselves in a really difficult position because they were finding students, vulnerable, upset, feeling isolated, really worried about the situation that they were in, often cut off from their family and friends. So there was a lot of pastoral support that our members were offering at that time. We had difficult situations where we had security staff who did find, students on occasions who
were in a bad way. That might have been through, you know, taking alcohol, drugs, that kind of thing. We actually did sadly also have an incident of a member's death, you know, throughout that time, which wasn't actually directly related to COVID. It was one of these things that happened. But typically what happens is that our members, particularly security staff in a situation like that, can be the first people on hand. And we did have members at one institution who found themselves in a horrible situation, you know, where they had to go and tend to that young man who ultimately lost his life as a result of that. So, you know, really finding themselves in a situation where they were going over and above what was, you know, part of their day-to-day, you know, jobs. And whilst some staff, some of the security staff had some training, some mental health training, that is not true to say for particularly the cleaning staff, who are the lowest paid members, you know, within the university and college sector, and they found themselves in really difficult situations. And of course, they were going into, you know, accommodations with no protection at the time either. There was certainly no PPE available.
I wanted to ask you about.
Yeah.
I'm going to pick up on the comments you've made in relation to the mental health impacts on your members and thinking about those categories of workers you've spoken about there. But you were coming on there, I think, anyway, to talk about PPE, and your statement sets out that those workers who continued to attend campuses and in particular halls were doing so, and you say, without sufficient or appropriate PPE. Can you tell us what sort of PPE would have been necessary for them carrying out the roles that they were doing?
Well, we would argue from Unite that they should have had full PPE, but they didn't have PPE at all, certainly not in the initial phases of the pandemic. They had face coverings, that was it.
And you say that the situation with PPE provision, you say it did improve over time, but you say there's an issue with appropriate PPE and also sufficiency of PPE, I presume in terms of the ability to access that PPE. How long did that continue for? You say it improved, but how long did it continue?
I mean, it's hard to remember exactly now, but certainly in the initial phases of the pandemic, you know, for months. I mean, when we had the first phase and we had students coming, you know, back into accommodations for the start of the semester in September 2020, certainly, you know, the workforce were without sufficient PPE, and some of those students had travelled from other jurisdictions, other countries internationally as well. So there was a real risk there around the transmission of the virus. You know, I think in time, you know, certainly, as I say, they were given, you know, kind of, you know, aprons, better, you know, kind of equipment and facilities. You know, even in the early days, sourcing things like hand wash and that kind of thing was difficult. It did improve, but we never got to a point where our members had what we would say would be the type of PPE that's used in clinical areas. It just wasn't available. And, you know, even when we got to the point where it got better, you know, there was issues around being able to actually use, you know, the masks correctly. So there was no risk assessments done, for example. So we had people that were coming into the workplace, they were getting kitted up, you know, with whatever protective, you know, what's the word I'm looking, clothing, or no, that's not the word I'm looking for, but whatever was there in terms of, you know, kind of aprons or you know, and face masks, but there wasn't any you know, support or training, you know, of how to actually use the equipment properly.
Thank you. I want to leave that issue just now and pick up on something that you mentioned a short while ago when you were speaking again about the halls of residence, and I want to hear from you a little bit more about the disproportionate impacts on various cohorts of Unite's membership. And you mentioned there was a disproportionate impact. It's at paragraph 16, and you refer to technicians in particular. You explain the impact on them in working in estates and operations, and you've spoken about the cleaning staff. I wonder if you can tell us a bit about the role of a technician within further and higher education.
Yeah, so the role of a technician would be to come into the labs primarily within the workplace and to set them up, to check on you know, kind of chemicals, the equipment, and make sure that, you know, the machinery and, you know, what was being used within the lab was fit for purpose. And at that time, there was, you know, kind of even from the very beginning, there was essential.
I'm sorry, Miss Maclean, I think we seem to have lost Lord Brailsford. Just bear with us a moment. I'm sure we'll be working to try and reconnect. Good morning, Lord Brailsford.
Good morning. Sorry about that interruption. We seem to have lost connectivity.
Thank you. Ms Maclean, just before we lost connectivity, I was asking you about disproportionate impacts on members of staff, and I was asking you in particular about the impact on technicians, and you'd been explaining to us a bit about what their role involves in terms of their work in labs. If I can ask you just to continue, please.
Yes, so I think what I was saying was that, you know, that their role was, you know, quite often, you know, to look after the health and safety of the environment. And I think part of the concern that Unite had at that time, certainly from a school's perspective, was that technicians were under pressure to come into work, you know, on that pretext of being, you know, kind of essential within the workplace and having to look after, you know, the lab environment. Whilst, you know, we argued often that should not have been a requirement. I mean, I think in the college and particularly the university sector, we did have technicians who were involved in supporting labs that were undertaking essential work, you know, actually in relation to you know, COVID itself. You know, Glasgow University, for example, was heavily involved in that space, but also essential work, for example, in cancer research and such like. So the technicians were definitely a cohort of staff who, you know, had to attend the workplace on a more regular basis, and the risks associated with doing that.
Thank you. And staying with the theme of disproportionate impacts, you mentioned that ethnic minorities and also women, in particular those over the age of 40, were disproportionately impacted. Can you elaborate on that a little bit for us?
Yes, so typically in you know, the roles of cleaning roles and janitorial roles as well, they tend to be populated by employees who are in the older age grouping. So, and primarily women undertake that cleaning role, and as I say, older women, and quite often some of those women come from, you know, the BME communities, and also a lot of them have got underlying health conditions as well. For security staff and also facilities staff and janitorial staff for that matter, they tend to largely be, you know, males, but again of the older age group as well, so more vulnerable, not just because of their age, but because of potentially underlying, you know, health conditions as well.
Thank you. You have a section in your witness statement about hub schooling and the staffing of hub schools. That's at paragraphs 10 to 12. And I understand your remit, as you described, is further and higher education, and that this section of your statement was informed by your colleague, Christina Hogg, who is the Vice Chair of Glasgow City Council Local Authorities Branch of Unite Scotland, and Ms Hogg has provided a confirmatory statement for these sections of your statement, and that can be found at WT 0156-50 and a 1. If I can just take you to that section there and what you've set out in your statement. You say hub schools were in the main staffed by support for learning staff or child development officers, with the addition of some teachers on a rota system to ensure equity of staff engagement. Before we go into that in great detail, I wonder if you can explain to us a bit about the role of support for learning staff pre-pandemic.
So pre-pandemic, the support for learning staff and the child development officers, they're a separate role actually, but they're primarily as a support role to the teaching staff. And they're involved, the child development officers, in providing the learning and development, you know, of young, you know, people and children within school, and also nursery settings for that fact. And they support the teachers with the curriculum and with the teaching plan and with delivering the learning and the development of the young people. The child development officers, they are employed, you know, directly by the council, the local authority, and they also liaise, particularly when it's a kind of vulnerable young person. They've got a role in liaising with social services, for example, The support for learning worker is someone, again, who works with the teachers and the child development officers within the school setting, but they're more involved in the kind of hands-on, play type activities, supporting children at break times, at lunch play, with regards to administering medication and personal care to children that require it. And they also provide support with things like literacy skills, basic skills like that.
Are the support for learning staff typically based within a classroom, literally working alongside the teacher?
Yes, they are.
And the child development officers, are they likewise?
Yes.
And are the support for learning staff, are they registered teachers?
No, they're not, and nor are the child development officers.
Okay. I want to ask in terms of their role in hub schools, was their role by and large the same as you've just described there, or was it somewhat different?
I think they tried for it as much as possible. I assume you're referring to during the pandemic period.
Yes, during the pandemic period.
So as far as possible, I think they tried to keep it as normal as they possibly could. But I think because of the fact that, for example, there was children coming from different schools who were coming into a main hub school, and the teachers, the child development officers, and the support for learning staff would not necessarily have been familiar with those children. So they didn't know where they were in terms of their academic ability. They didn't necessarily know what their care needs were, because school is so much more than the kind of education. It's about that wider pastoral support as well. So I think they did try as far as possible to have lessons planned and lessons in place, but it was difficult because they were dealing with a group of children that not only did they weren't maybe familiar with, but they were working at different levels as well because of the cohort. The children were of different age groups, for example, as well. And I think the reality of it was that more of it, as I understand, was around just looking after them on a day-to-day basis, making sure that they were okay, with more of an emphasis on kind of play-type related activity, as opposed to absolute structured lessons the way it would have been in normal times.
And were the children attending these hub schools, was there always a teacher in the classroom with the pupils and the support for learning staff?
As I understand it, yes, there would have been a teacher available in the school, but there were more child development officers and support for learning staff than what there were teachers. So the reality appeared to be that there was an over-reliance at that time on these staff who volunteered actually to do the roles. They weren't compelled to do it, but really, particularly for the support for learning, staff there, again, low-grade staff, who took the risk to come into the workplace to support the children that they obviously care about dearly. They did that voluntarily, and often, some of these staff had their own children at home. And they had to obviously leave them there. They couldn't, take them to work with them at that point in time. So, they were risking going into the environment and potentially going back home and taking COVID back into their home.
And did these workers, these support for learning staff and child development officers, as far as you're aware, did they have access to hub schools for their own children?
No. Sorry, just to clarify, that was the point that I was just making there, that they did not have access. They had to leave their children at home and make alternative arrangements for them.
Okay. I want to move on now to asking you about the impact on your members working in SQA, and in particular the impact on their ability to work with teachers, as you headed that section of your statement, which starts at paragraph 34. Can you tell us first of all about the sorts of roles your members have within SQA?
So a variety of roles. I think, as I was saying earlier, we represent members at the SQA at every level. We have members who work in the qualifications development team. We have members who are responsible for developing qualifications, so they've got close relationships with teachers and centres. Obviously, a number of them work not just within schools but within the further education, college environment where qualifications are delivered there. We have members who work within the accreditation and regulation function within SQA as well. Members that work within IT, within the policy and standards team within SQA as well. So right across, the whole piece, and they do have, a day-to-day responsibility to be, often liaising with students and with schools rather than the centres.
In terms of those, if I can look first of all at those working in what we're calling qualification design and their work alongside teachers, is that to design what the exam will look like in terms of content and so on?
Yes, my understanding is that is part of the role that they undertake, yes.
And in connection with assessment, is that establishing things like grade boundaries, for example?
Yes, it would be grade boundaries, and it would obviously be, the exam design, for example, as well, yeah.
Thank you very much. And can you explain a little bit to us about why it's essential to their role to work alongside teachers?
I mean, it's an integral part of the role. In fact, some of our members at the SQA were former teachers themselves, and they've got the knowledge and skills that they've got to actually bring, to be able to, the qualifications body, for Scotland. So, their expertise is key to that. And I think what's really important, and I think a huge frustration for our members at the SQA, is that over a long period of time, they had developed and fostered very good relationships, with teachers. Sometimes that came under, a bit of scrutiny, but none more so than during the pandemic and what unfolded at the SQA and what has happened now to the SQA since with the announcement, to reform the SQA, which was ultimately what happens as a result of, the debacle, I would say, during the pandemic and the impact on the young learners in Scotland.
In terms of what happened during the pandemic, how did that way of working during the pandemic impact their ability to work alongside teachers?
I mean, it was terrible, frankly, because what happened was the decisions that were made at the SQA at that period of time in relation to the alternative certification model were made by the SQA Chief Executive and the Executive Management Team, and our members who would ordinarily have been involved in exam procedures did not have a say and were calling out concerns from a very, very early stage. Concerns that actually Unite as a trade union challenged in some of the ministerial meetings, prior to the announcements of the exam results in 2020. So we were aware, and our members were aware from quite an early stage, that the alternative certification model was not going to work. It had a really negative impact on the learners of Scotland, and as a result, I think a lot of the teachers and the centres saw the SQA as elitist, as isolated, and our members are very clear they did not bear the responsibility for that. These decisions were made and they had no say in them whatsoever, and not only that, they were extremely worried about it, but they weren't listened to.
Okay. You mentioned, again, you've mentioned the ACM just there in your response to my question, and you say at paragraph 35 and 36, you mentioned there was an over-reliance on algorithms that didn't take account of the professional judgment of teachers, and I presume of your members also.
Yes, so I mean, our members would have had, the expertise, had they had the opportunity to actually sit round the table and talk about what an alternative certification model should have looked like, against the backdrop of the young people of Scotland not being able to sit, their exams. And arguably that should have looked at not just the historical data within schools and what was available, but the teacher estimates, and that's exactly what ended up happening after the public outcry when the exam results were published. So as I mentioned, they had no say in that, so their professional judgment was disregarded.
Can you explain to us what was the impact of that, first of all, on your members, and you mentioned learners, and on the ACM as a whole?
I mean, so we'll go to the learners first, and what obviously happened was that the exam results were published. There was a lot of young people did not get the results that was anticipated. The schools, the centres were extremely and quite rightly very angry about it. Teachers themselves, did not feel heard because there was young, people that they felt should have been awarded those exams that weren't, and subsequently, the First Minister at the time overturned the results or the decision around the results, and teacher estimates were subsequently used. And because of that, what happened was our members were blamed, frankly, for those decisions that were taken at senior level within the organisation. And there was a media frenzy around that. There was huge pressure. And I think the Scottish Government came under huge pressure to make the decision to effectively scrap the SQA as a result, because at the time it was viewed that they were not fit for purpose. And our members, quite frankly, were used as a political football and all of that. And we're now, 2021, June 2021 was when the decision was made to reform the SQA. And we're now, 3.5 years down the line. And our members still do not know to this day what is going to happen to them in the future in the new Qualifications Scotland, as it's now going to be known. So it's taken its toll on them. It's caused a lot of stress, a lot of anxiety. They've been expected to get on with it, business as usual. And not only that, during the period of time, the same pressures that faced every single other person, who were trying to do their best day to day, go to the work during the pandemic. These pressures were on our members at the SQA as well. And as I say, we're now, 3.5 years down the line, and we've still got a situation where members are expected to deliver a reform agenda and get on with it, with no acknowledgement really of the impacts on their own health and well-being. So it's not been a good story for our members at the SQA, and I'm afraid it continues to be very difficult for them.
Thank you. One thing that you say in connection with what you term the lack of transparency in connection with decision making to do with exam design during the pandemic, you explained there was an erosion of trust. Do you mean between SQA and Unite's members, or do you mean more broadly than that?
Definitely between SQA and Unite's members, but I also mean more broadly. So the lack of trust, was with teachers, the centres, with colleges, I also think with the general public and the learners of Scotland, frankly. Primarily the young people. I mean, I remember actually that day of the exam results, when the students had been marked down, actually looking at social media and some of the comments from the young people of Scotland about the SQA and what they had done to them, and that had a really terrible impact on the mental health of young people, and it was well documented at the time and has been since. So it was right across, I think, most of the areas that the SQA, because of poor decision making at the most senior level, had lost the confidence of ordinary people, of the public, of the learners of Scotland, and certainly our members lost trust and confidence in their employer, because they were severely impacted by that. And I mentioned disputes at the beginning in terms of some of the work that I'm involved in. We've had successive disputes, unfortunately, in industrial unrest at the SQA, because there has been a long standing concern around trust and confidence within the SQA and the voice of the workers within the SQA, and the fair work principles that are supposed to be adopted by public bodies. And to this day, the people who made those decisions, the chief executive and the executive management team at the SQA, most of those individuals are still in post to this very day.
Are you attributing the erosion of trust, as you described it, and the lack of transparency leading to the erosion of trust to the pandemic period and the decisions that were made at that time? It sounds like you're speaking about a wider issue there. I just want to be clear on that.
It's both. It's both. It's what happened, during the pandemic in terms of the disastrous decision around the alternative certification model, and that has set the catalyst, I think, for what has happened since. And certainly, the reform of the SQE has been hanging over our members for a very, very long time now. And really what they need to know is, do they have future job security? And I think the other point I want to make is that our members at the SQE want change. They want to have good relationships, with the teachers in the centres. And I think by and large that has improved, and they are continuing to develop that, but it's taken them a long time to actually regain that trust at that level. Yeah.
Thank you. I want to go back now to impacts on members' mental health, and it's something you touched on earlier on when you were speaking about those attending the workplace in person and working in halls of residence. You mentioned the cleaners and the security staff. At paragraph 57 and following, you set out that there was a lack of training for those working in student mental health services. Were Unite members staffing student mental health services in any sort of formal way?
Not directly, no. And I mean, you're saying with the staffing student mental health services, I mean, there wasn't, to the best of my knowledge, any dedicated student mental health services in provision there, on campus or or in residences primarily, which is where our members would have been and where their interactions would largely have been. And the reality was that often our members were the only point of contact for students, kind of during that period of time, and they would unfortunately find themselves in a situation where they would maybe find a student, in crisis, and they did not have the adequate training and support, to deal with that. But there was no one else to go to, because lots of other staff that might otherwise have been there and would have had a dedicated role on a day-to-day basis to support students in crisis and their mental health and well-being were not present within, the workplace or within the residences at that time. So they were absolutely often the first point of contact. And aside from some mental health training that I know that security staff get as a standard, as part of their role, there was no provision made, and there still has been no provision made to this day. I've got to say that there is not a resource and a budget for mental health within colleges and universities for support staff. So in terms of lessons learned, my view is that there hasn't been any lessons learned there. And that's an important issue that needs to be looked at as a matter of urgency.
Thank you. In connection with thinking about any provision for students' mental health, we've heard from college and university principals in the last couple of days about steps that were taken, for example, with helplines or check-ins with students. Is that the kind of activity your members would have been aware of that was happening on a wider basis, or would they just not be aware of that?
The honest answer to that is I'm not sure. My kind of experience of this is the feedback that we got was from our members saying directly how it was impacting on them. Did they have signposting or services that they could perhaps put kind of students in touch with? Yes, I would say that I would understand that and imagine that they did, but I can't be 100% sure on that. But I think the point I want to stress is that it was they were the first point of contact. They were the individuals that were finding the students in a precarious position and expected to deal with it. Because let's face it, if someone is in a difficult situation, you don't just walk away from it and say, "Oh, hang on, I'll give you a helpline number." Bye. Any decent human being and people work in that sector because our members primarily they care about the students. That's what it's all about, and quite rightly so. And the focus has been on student mental health and well-being. And I think that's absolutely correct, that it should be. But if there was half of the effort in terms of supporting, the workforce health and well-being, then the sector would have been doing well.
Was it understanding on the part of employers that this was the reality of the situation? You mentioned cleaning staff, for example, in halls of residence encountering students in difficulty. Was it understanding that was the reality of their job during the pandemic?
Well, there should have been, because we didn't stop complaining about it as a trade union at that point in time. Any opportunity that we had to raise our concerns about the impact on our members' health and well-being, we did. At various forums and meetings, and we have done since, with regards to saying that there's a longer term impact, here to be looked at. So, yes, I would say that the employers absolutely were well aware of it. I mean, there was a student mental health and wellbeing working group set up at that time, and the unions, had a place within that group, and we asked for a similar employee mental health and wellbeing group to be set up, and I think institutions at local level, they did try to an extent, to support their staff, but the reality of it was that it was just really firefighting day to day, and there is no budget within the college and the education sector currently, or at that time of the pandemic, to support staff mental health and wellbeing.
Thank you. And it may seem obvious to you, thinking about the impact this lack of training and then their experience will have had on your members. Can you just elaborate a little bit on how that impacted them as individuals and as professionals?
Yeah, I mean, I think it had a really negative impact on their own mental health and well-being, because they found themselves in situations that they weren't well equipped always to be able to deal with. They were dealing with their own stresses and anxieties at that time, around being present within the workplace, being on the front line, having to deal day to day with very, very difficult situations, and then to be returning home to their families at the end of their shift, having potentially dealt with situations that they never thought they were going to have to deal with in their lives, frankly, and they had their own domestic issues to deal with as well. So it's been enduring. I would say the impact on our members' health and wellbeing. We've seen it in terms of levels of sickness absence. We continue to see it. The mental health is one of the top issues in terms of sickness absence within the sector. So it has been enduring. Yeah.
I want to ask you just very briefly just now about communication with the Scottish Government. Excuse me, and you've answered in part, at least in connection with mental health. You've said we never stopped going on about it, I think were the words that you used. Were the impacts you've described for us today and also in your written statement, were they relayed to the Government at the time?
Yes, they were relayed to the Government at the time, because that was how relaying issues about mental health in general, that was how the idea and the notion of the student mental health groups were established. So yes, the employers were certainly well aware, the Scottish Government were aware through the forums that we sat on, that we had real concern about it, yes.
And is that likewise in connection with, for example, the impacts you mentioned on the SQA staff and the disproportionate impacts we spoke about in the hub schools?
I would say the Scottish Government to a lesser extent with regards to the SQA, because the committee certainly that I regularly attended was primarily around further and higher education, but we certainly did call out to the employer, and the employer were very well aware about the negative impacts on staff at the SQA. What
was that committee that you've just referred to there?
It's there in
the Education and Skills Committee
group, the Education Recovery Group. Yeah,
okay.
That was the main one that I sat on.
Thank you very much. And just in closing, and you've mentioned a little bit in your evidence already about lessons learnt already, or lessons that ought to be learnt. Are there any such lessons that Unite Scotland considers should be applied just now to ensure that the impacts are addressed and mitigated?
I mean, I do think that there should be mental health training and support provided to frontline staff all across the sector. I mean, no one ever imagined for a minute that we would end up in a terrible situation like we did. So, we couldn't have foreseen what was going to happen, and hopefully that we'll never be in that situation again. But Unite do not feel that lessons have been learned within the sector, because our staff, our members, are still expected just to kind of turn up to their work and get on with it. And there hasn't been the time taken, or indeed the resource and the money there to actually train staff to be future equipped to deal with these situations in a better way. I mean, the other thing that I would say is a key concern, I mean, we haven't spoken about it today, is there's a section in my report about the impact on 800 staff who were employed at the diagnostics lab in Glasgow, one of the biggest labs in the UK, who was undertaking testing at that time. Now, there was almost 800 staff employed there at one point. They were all ultimately made redundant. But in terms of future learnings, there is a real concern, not just about what happened to that skilled workforce, but also that there is no future preparedness in the event that we did have another pandemic, because all testing has been stood down. And that is a real concern. And I think others have given evidence in other areas of this inquiry, saying that actually the fact that we did not have testing available at the beginning, it took us a long time to get that up and running, and now we've actually depleted that to the point where it doesn't exist. So we do not have a contingency there in the event that happens again.
Thank you very much, Ms Maclean. I don't have any further questions for you, my lord.
Thank you, Ms Stewart, and thank you, Ms Maclean. I apologise for the interruption in the middle of your evidence. I hope it wasn't too inconvenient for you.
Thank you.
Very good. 11:30. Thank you very much.
Good morning, Lord Brailsford.
Good morning, Mr. Stephen. Now, you have a witness for us?
I do, my lord. The next witness giving evidence today is Lorcan Mullen of UNISON, Scotland.
Very good. Good morning, Mr. Mullen.
Good morning, my lord.
Right, Mr. Stephen will have some questions for you, so I'll invite him to start.
I'm obliged, my lord. Could we start by asking your full name, please?
My name is Lorcan Mullen.
Thank you. And you've already provided a written statement to this inquiry, and for the record, that inquiry reference number for the statement is SCI-WT 0375 5 zeros and a 1. Just to reiterate at the outset that everything you've said in that written statement will be taken into account by the inquiry, even if we don't touch on every single aspect of that in your oral evidence today. And just a gentle reminder that the hearing is being transcribed, and stenographers are taking notes for that reason. So, and the chair will also be listening and taking notes. So, please do try and speak slowly and clearly, and I will try and do the same. All right, thank you. So you're here today to give evidence on behalf of UNISON Scotland, is that correct?
That's correct.
Right. At paragraph 5 of your statement, I think you described the role of UNISON, the wider organisation, that is. You state that to be the public service union, Britain's and Europe's largest public sector union with more than 1.3 million members. Is that right?
That's correct.
Yeah. What is the key role or aims of UNISON as an organisation?
For those public service workers in hospitals and schools and universities, colleges, water, gas, electricity, a range of different services, is to make sure that there's an organisation that can organise those workers effectively to protect and enhance their terms and conditions, and to make sure that the services that they work in are properly provided for by governments at different levels and properly supported and properly resourced. So we've got a negotiating role, a campaigning role, and a role organising our own structures to achieve all of that simultaneously.
Thank you. And I think your statement says at paragraph 6 that UNISON represents anybody who's employed in public services, excluding, I think, civil servants who are employed by government. Is that right?
Mm-hmm.
Thank you. Now, UNISON Scotland, is that one of the regions falling under that wider UNISON umbrella? How would you describe the relationship between UNISON and UNISON Scotland?
Yeah, in real big terms, it's a region within UNISON, but we tend to use nation now for Scotland and Wales, as you might imagine.
Thank you. Yeah. Thank you. In terms of numbers, then, what is the size of the overall membership of UNISON Scotland?
Last I checked, it was just over 162,000.
And what's the sort of demographic, if you like, or composition of that membership? How does it break down?
So our biggest service groups, and this may have been covered in more detail by colleagues of mine that have given evidence, would tend to be in local government and in health. Higher education and further education are two of our smaller service groups, and a service group is basically a division based on like an employment sector or industry, if that makes sense.
Yes. And I think you say at paragraph 6 of your statement that you have over 70 employer-based branches in Scotland. Is that right?
We do.
Yeah. And I think at paragraph 7 you talk about having 140 staff members working in organising and support roles.
Mm-hmm. That's correct.
Yeah. In terms of further education, you have a Scotland-wide branch. Is that right?
That's correct.
And how does that branch function then? How is that comprised?
You would have representatives elected at a local level, at a college level, and they would come together in a committee. Members would elect officers annually, and they represent college workers along with full-time officials in the different negotiating machinery, which in further education is at a Scottish level, but also making representations to the constituent employers and the government in any other relevant forums.
Thank you. And for higher education, you have a branch structure based on the universities. How does that work?
Yeah, in most cases in higher education, the branches are based on a particular university. But to take Aberdeen as an example, there's a branch that encompasses both the universities there. So there's slight local changes, but generally FE is a national branch in Scotland, and in higher education it's based on particular universities.
Thank you. paragraph 9 of your statement, I think you say that UNISON Scotland is the largest union for those working in professional and support services in higher education and further education. So of that number of 162,000 that you mentioned earlier, membership in Scotland, how many members are in further education and higher education?
As per the statement, over 3,000 in each sector.
Thank you. And can you just briefly explain what those roles are that we're talking about when we're talking about professional support and services roles? What are those?
It does differ slightly between university in terms of the areas that we would cover, or say that Unite would cover, who gave evidence just before. But generally speaking, we are the primary union for cleaners, for front-facing library staff, for security officers, for IT staff, administrators, counsellors, and then a range of other what we call professional services staff. So that's just other kind of white-collar support staff that are involved in supporting education professionals and supporting students on campus.
Thank you. And how would you describe the significance, I suppose, of the contribution that those staff make to the supporting of that delivery of teaching, of education, and the operation of universities and colleges?
It would be impossible to deliver any meaningful, let alone successful educational experience without the work of those people. So that's not in any way to de-emphasise the contribution of teachers, lecturers or other professionals, but those generally lower paid members of staff, they do that crucial work in the background to make sure that these environments are safe and effective for learning. So you can't have a university without a smoothly run library. You absolutely couldn't function if these buildings weren't properly cleaned and maintained, and you absolutely couldn't have the smooth running of different departments within universities and colleges if you didn't have an effective administrative service running as well. And in UNISON we always make the argument that if those support roles are properly resourced, that frees up people like teachers, or to take the health service as an example, doctors or more senior nurses, it frees them up to do their job more effectively as well. So UNISON emphasises that one team approach that celebrates the contribution of all members of staff to providing an effective public service.
Good morning again, Lord Brailsford.
Hi, Mr. Stephen.
Thank
Good morning.
I've been told we're okay to resume, my Lord, so if you're content, I'll proceed. Thank you.
Please go ahead. Thank you.
Thank you. We'll move on then. I mean, the purpose of today is to draw out the key issues and impacts experienced by those members which you represent. And I'd like to start then, please, with the closure of college and university campuses, if I may. At the outset, I use that term closure, but as the inquiry has heard in evidence in recent days from colleges and from universities, it wasn't necessarily the case that these institutions were completely closed down. Now, in paragraph 10 of your statement, you highlight the closure of colleges and university campuses in the early stages of the pandemic as having a big impact on UNISON members. And you say that UNISON made strenuous representations to member institutions to ensure that a prudent and precautionary approach was taken to prioritise the safety of staff and students. Can I start by asking when, during that pandemic period, UNISON started to make those representations?
It's hard to place an exact date, but I can recall as the regional organiser, when I first became aware of the seriousness of what was coming in COVID-19. I remember it was March 5th was my birthday, so it was just immediately after birthday weekend, watching some of the news coming in from Italy and just realising, just thinking things through logically in terms of the time lag from infection through to hospitalisation, the wider spread, that this would be coming our way, and I felt a deep responsibility at that time as the lead officer in higher education to speak to senior colleagues within the union, but also the senior elected representatives within universities at a Scottish level for UNISON as well as at a branch level, emphasising the seriousness of the situation, the particular risks for people working in universities, given that they're such hubs for international travel, and to begin looking at what best practice might be and looking at bringing together groups of representatives to ensure that best practice could be enforced locally.
Thank you. To be clear then, what was the prudent and precautionary approach that UNISON was advocating for?
Really just to close campuses as a precautionary measure to ensure that people were at no detriment in terms of their pay and their terms and conditions, and just to ensure that there was fair and equitable treatment right across staff groups. We were acutely aware, and this isn't in any way a criticism of the teaching staff or managerial staff that were doing this to protect themselves and their families, but we were acutely aware that people who were able to work from home were beginning to do that at that time, and that didn't escape the attention of people who had to report for work because of the nature of their job. So security officers, cleaners, porters, library staff, they could see what was happening with some of the more senior colleagues, or the colleagues that worked in teaching roles, and there was huge anxiety and huge concern that they were accruing a risk to themselves and to their families that wasn't true for other members of staff. So that was absolutely getting identified and fed up through our structures.
Thank you, and we'll come back to that point about anxiety that you mentioned. So the rationale then for the approach that was being advocated for closure, am I right in saying that you were saying that was to, I suppose, for a level playing field? Was that what you were looking for between teaching staff as well as those working in professional and support roles? Is that what you were looking for, equity or fairness, or however you would like to?
Yeah, absolutely, for a prudent precautionary approach to be taken for all staff. And when we say closure, that's not talking about the sudden eviction of people living in university halls or residences, but as far as possible, a closure of campuses until we were able to get a keener sense of the risks around the pandemic and mitigating measures that would keep people safe.
Okay, thank you. How did higher education and further education institutions that you were dealing with, how did they respond to the representations that UNISON was making on the closure of campuses?
So I'll start with higher education because I didn't cover further education at the time, but I'll come back to that in a second. In higher education, there was there was a variation in the approach taken by different universities. So different university principals, senior management teams responded differently to the common risk. Some were very proactive and very conducive in their discussions with the trade unions and taking that precautionary, prudent approach in terms of sending people home, putting measures in place for people that were known to be clinically vulnerable. Other universities, often where industrial relations were a bit more difficult and a bit more attritional, waited until they were told to do these things by the government, and that was something that we identified at the time as being, again, unfair in terms of a level playing field. We encouraged a consistent approach based on what we identified in real time as best practice to keep as many people as safe as possible.
Thank you. At paragraph 18 of your statement, you say that employers and I think management, at least became resentful of discussions, increasingly resentful, where workforce representatives participated. What would you say was the reason for that resentment in your view?
I think looking back at the statement, that's a wee bit out of sequence. So I think that dynamic really emerged later in 2020, and I think that was after we had been engaging on more or less an equal footing with the ministerial leadership group and the successor group, and I think there was a growing sense that the employers were wanting to prioritise their commercial considerations over some of the more strenuous safety first approaches that we were asking for. So it wasn't across the board with universities, it wasn't across the board with colleges, but as that initial blood spirit kind of wore off, and as we got closer to vaccinations, I think there was a more hard-headed approach from a lot of leaders in both sectors about people returning to campus.
Thank you. Sticking then with early campus closures, you also mentioned at paragraph 10 of your statement making representations to the Scottish Government as well as the member institutions. Now at this impact stage that the inquiry is at, I'm not going to go into the detail of implementation and decision making because that's not for now, but what I was going to ask you is, do you know by what method or forum these representations were being made to the Scottish Government?
Through correspondence, through discussions with civil servants who would have had responsibilities for higher education and further education, and from the overall leadership of UNISON Scotland making representations direct to the First Minister, calling for detailed engagement on safety measures and the consistent application of Scottish Government fair work principles through the crisis. So through those range of measures.
And would those representations have been made more than once?
Yeah.
At paragraph 12 of your statement, you mention inconsistent approaches being taken by institutions in further education and higher education to the closure of campuses. Would you be able to highlight to the inquiry an example or examples of that inconsistency that you're talking about?
I remember that at the time because this was phone call after phone call with branch secretaries, branch chairs, branch health and safety officers at different universities, just about how their senior management teams were reacting, and this is before the UK government lockdown and before more detailed direction and guidance had come out from both governments. It was just clear through those conversations how different universities were responding. So I remember at the time being pleasantly surprised by the University of Stirling, who were often a fairly difficult customer for us in terms of local industrial relations. They really took a prudent and proactive approach with their principal in the vanguard. But Edinburgh Napier, as is clear in the statement, they at the time appeared loath to put in place voluntary measures to send more staff home at no detriment, to take that prudent precautionary approach to protect all staff. And I remember deep unhappiness from our local representatives at the attitude that was being taken.
Yes, and I think the language you use in paragraph 12 in relation to the Edinburgh universities, they ran it up to the wire before any announcements were taken at UK level. Is it your view then that, or UNISON's view, that these institutions should have acted earlier rather than waiting for such announcements to be made?
I think we'll always expect some variety amongst employers, but we really needed to have a more consistent approach at that time, and we really needed university leaders and college leaders to see that this wasn't just another industrial relations issue that we were raising. This was something that could have been life or death for frontline staff, or the families of frontline staff, for people living with them. And I think for some university and college leaders, they struggled to recognise that. It maybe just seemed to them like just another union issue, just another union claim, which I think is deeply unfortunate.
You also speak in that same paragraph about that institution in Edinburgh being loath to make such a huge commercial decision. What do you mean? What do you mean by that?
I think that's true of all universities and colleges, and I suppose all businesses that were suddenly having to completely change their operational basis in response to the pandemic. But other universities, as we've discussed, were prepared to take that step to keep their people safe. Others were prepared to wait and see what they were obliged to do, and that's certainly the recollection of UNISON Scotland at Edinburgh and Napier were particularly difficult at that point in time to persuade to take that consistent precautionary approach.
Thank you. Paragraph 10 of your statement, you say that an earlier intervention by the Scottish Government would have ensured a consistent approach throughout the further education, higher education sector. Mm-hmm. I think you said that would have been welcome. Mm-hmm. Is it therefore your view that this is something on which the Scottish Government should have intervened earlier?
Yeah, I mean, we'll cover this later in the evidence, but I think overall the Scottish Government's response at bringing key stakeholders together was good, and I think there were real gains for our members and for frontline staff out of that engagement. But a week, 10 days earlier, having those types of discussions would have been even better, and I think that would have given a lot more consistency and a lot more assurance, because I think it's hard for us to remember back then when COVID-19 was a new entity, and we just didn't know what the lethality would be, what it exactly would look like in terms of infection. When there were so many unknowns, that extra week, 10 days of acute anxiety for people who knew that they would have to be going into work in these front-facing roles, that can't be underestimated in terms of the effect that had on people. So absolutely, that would have been better avoided.
So that might be something perhaps that could have been done differently. The inquiry is obviously interested and will ultimately be making recommendations. So that's something you think could have been done differently.
Absolutely. Yeah.
Okay, thank you. In paragraph 13 of your statement, you say that UNISON's lead representative for health and safety, and I ask you not to name them, within Scotland's colleges described the approach taken to closures as chaotic, with much uncertainty and little meaningful consultation with workplace representatives. Firstly, is that description of chaotic, is that a description that you would agree with?
Yeah, I find that credible. Yeah.
Okay. And you said little meaningful consultation in your statement. Did any or some consultation take place on this subject?
Again, we're talking about the responses of various different institutions right around the country, so I'd be loath to make complete generalisations, but my understanding, and I believe this report is credible from the branch's health and safety officer, that there would have maybe been some superficial discussion, but there was a lack of consistency and a lack of follow through in terms of operational practice in a lot of colleges. I believe that to have been the case, yeah.
And what would you ascribe or attribute the chaos to? I mean, what do you think the reason for that reasons for that chaos was?
I think there was an element of chaos in most institutions' responses, organisations' responses at that time, but I think within Scottish further education there was even more of that difficult attritional industrial relationship, and I think that might have impacted on how some colleges responded to trade union representatives asking for significant operational changes to be made to keep people safe. I think it's difficult to separate those two things. I think it's deeply unfortunate because safety measures with an unprecedented public health crisis in Scotland is an entirely different matter from a pay claim or a discussion about local shift allowances or something like that. But I feel like that would have been the reason why there was that lack of consistency and there was that element of chaos in the way colleges responded to those types of arguments from our representatives.
Thank you. You also say in that same paragraph 13 that there was a period of weeks where teaching staff had acted independently and set up working from home already, indeed before institutions closed their campuses to the extent they could. But support staff still expected to come into the were still expected to come into the workplace as normal. And then at the end of that paragraph, you say even administrative staff employed in halls were forced into work when they could have done their duties at home. Was there a basis on which such staff could volunteer to come onto campus, or was that mandated?
I think that's referring to one particular college. I'll not name that just because I'm not 100% certain of it, but I think that's a really unfortunate example where people could clearly have done their role from home, but the college was maybe being a wee bit opportunistic in terms of the fact that they worked within residences which continued to operate and they were able to come into work. So that would highlight that unfortunate, management's right to manage attitude coming through rather than safety first for all members of staff.
In paragraph 13, you say that colleges decided to have a skeleton workforce on campus, and indeed the inquiries heard oral evidence to that same effect earlier this week, I think in terms of IT and estates maintenance being mentioned as examples. In what roles were the workers that you deal with, the members, deployed as skeleton staff during that time?
As per the statement, janitorial staff, some cleaning staff, IT staff, some library staff, some nursery staff, and there would have been local variation in different colleges.
And given that skeletal nature of the workforce, are you aware of any examples in which those workers or members would have been asked to go beyond their core roles?
For this part of the evidence, because I didn't cover further education at the time, I was reliant on a report, so it'd be loath to go outside that at this stage.
Okay, thank you. In paragraph 14, you state that Scottish Government guidance to college employers in relation to the definition of essential work didn't arrive until I think the week commencing the 24th of March 2020. Is that guidance something that you felt the Scottish Government should have issued earlier?
Again, there are aspects of the Scottish Government response that we thought were useful to frontline staff, but if these guidance papers had arrived earlier, that would have went a long way to ensuring consistency of approach and alleviating that deep anxiety and fear that was held by frontline staff and that deep anger among some staff about the differential approach and the lack of consistency.
I think you say at that same paragraph 14 that up until that point, UNISON Scotland's further education branch was left to negotiate with college leaders. So it's what you're saying there that it ended up being a sort of case-by-case or ad hoc negotiation because that guidance was not in place.
And it's important to emphasise that that's quite difficult for a union to resource. If you suddenly have to have these discussions with that type of depth with every employer that you deal with simultaneously, that is a huge amount of work. So that's not against being hard working as a union rep, particularly in those circumstances, but it shouldn't take that to achieve a consistent safety first approach in a public health crisis.
In paragraph 14, you also say, I think, that UNISON's position was that college buildings should be closed and that home working should be the default position for everyone. Was it possible or feasible for all kind of professional support and services staff to be able to carry out their roles working from home?
I think when you take into account the furlough scheme and the steps that could have been taken for people who couldn't feasibly do their work from home, yes.
Because as you may be aware, the inquiries heard oral evidence earlier this week from both colleges and universities, and I think certainly some of the evidence that was listened to, it was suggested, I think, that for some universities at least, it wasn't necessarily an open or closed binary choice. It was more complicated than that. I think, for example, research projects, medical projects was mentioned as something that would need to continue. And I think all described it as an enormous challenge, given, as I think you've said, about the unprecedented nature of the public health crisis. And therefore, I think the evidence given was that janitorial staff, those there to support IT infrastructure, for example, were needed and were needed on campus. What would be UNISON's response, or your response to that point of view?
Well, for this paragraph specifically, that's about colleges, and it's important to differentiate between colleges and universities. Some universities do have residential accommodation, but not many. So a precautionary closure of the campus is something that, generally speaking, would be more easily achieved in colleges. So that's a bit different from universities. I think they would have had more scope to do that. In universities, absolutely, where students are living on campus, where you have medical research, where you have other aspects of critical research that we wouldn't want to have seen be interrupted. Those are distinct situations, but there was a huge amount that could have been done a bit quicker and certainly a lot more consistently to take that safety first approach for all staff.
Thank you. I want to move on then to the impacts on the members you represent, the staff that were working on these campuses. And you mentioned it earlier, and at paragraph 15 you say there was huge anxiety amongst members working in, I think, student-facing roles and who were deemed essential staff. What were the key or particular concerns that were being made known to you by members about that anxiety?
I'm someone that's clinically vulnerable. I'm somebody who has somebody at home who's clinically vulnerable. I've seen people on television dying in large numbers in other countries or having to be hospitalised. What's going to happen with my job? If we are all sent home, are we going to get paid? What's going to happen to our jobs? If there are closures, is everyone going to get made redundant? Are the universities even going to have the money to pay us all redundancy? There was a whole constellation of anxieties there, but the primary one was danger to life, and that fear of infection with the virus, and that sense of anger that others within the campus community were already taking steps and being supported to take steps to protect themselves and their families.
You mentioned that sense of anger, and I was going to ask you the question, because you say at paragraph 15 you talk about, I think, an acute awareness, and you said it earlier in your evidence, of teaching staff perhaps not being on campus. Was that fueling the anxiety or anger that you mentioned? Absolutely,
and the teaching staff that were right to do that. That was the prudent thing for them to do for themselves and their families, particularly if they were clinically vulnerable or they had clinically vulnerable people at home or in their community. But yeah, we had people who were just as afraid as a cleaner or as a security officer. They were just as afraid of catching the virus and becoming seriously ill or dying or passing it on, but they were clearly seeing that they were at more risk simply because of the job that they did, and that hurts even more whenever you're on considerably less money, and day to day you don't get the same professional esteem for the job that you do. So there's that clear social gradient in terms of risk that we had to work very hard to mitigate through practical local measures and strong national guidance. You mentioned cleaners, and they wouldn't be the only staff by any stretch of the imagination that would need this, but you mentioned at paragraph 46 about PPE, personal protective equipment. Was access to that a concern or anxiety for your members that were working on campuses? Yeah, absolutely. I think you say initial efforts on PPE in most further education, higher education workplaces was chaotic. Is that right? Yeah, just grasping for what would actually be effective, what was available, who should have it, when they should get it, who would deliver that safely. I think it's fair to characterise that as chaotic in most cases, although obviously there was good practice out there, and I'm aware as a trade unionist that the good practice that people are happy with doesn't tend to get reported to us. It's the bad stuff that gets escalated. So that's the practice that we're made aware of, and that was widespread. Yeah. Thank you.
You also mention at paragraph 46 of your statement, I think, about ventilation. Were members also making concerns about the adequacy or not of ventilation, whether that's in academic residences, buildings?
I think that came much later, and that was something that was really identified more by senior trade unionists trying to look at comparative responses in different countries. So I think at the shop floor, I think this was reflected in wider society, a lot of the initial concern was over touch surfaces, and cleaning to try and prevent that. But obviously the evidence base clearly changed over time, and we became aware that this was a virus that was principally spread through airborne infections. So that whole debate over what was adequate employer response on ventilation was not really early 2020. That was more, I think, late 2020 onwards, just as the evidence emerged internationally, and we began to make arguments based on that evidence.
Thank you. And I think in that paragraph you talk about maximal pandemic proofing. Again, the inquiry will ultimately be making recommendations. Is that something you think that should be considered for the future in terms of the academic setting on campuses?
Well, absolutely, and I think we've made arguments along with other trade unions that good air quality in the workplace is an important thing to have generally for all sorts of different health conditions. But if the Scottish Government or the UK Government are committing funds to either renovating or building new public buildings, they should be built, they should be organised in a way that allows for high quality ventilation that would be effective at least in a repeat of COVID-19 or a similar type of infection. I think anything other than that would be a poor use of public funds, because if you had that type of quality ventilation, that means that some of the other safety measures that some would say were more difficult or more onerous or more disruptive, they could be adjusted.
In paragraph 16 of your statement, you highlight the work undertaken by professional and support services staff in adapting to a new model of teaching and learning, online or remotely. What was the burden or impact that was placed upon them in achieving that?
Well, if you can imagine yourself to be an IT technician who usually works on day-to-day maintenance inquiries, and suddenly your team is tasked with completely converting the entire teaching and learning model for the university and being able to support that, that's a huge ask, and there wasn't suddenly reams of additional staff hired, or in some cases any additional staff required to carry that work. A lot of the time the same people that were supporting the IT infrastructure to deliver that for students and teaching staff and managerial staff, they were the same people who were having to organise the distribution of laptops to students to enable them to actually engage with the learning at the same time. So again, there's different practice in different institutions, but that put a huge burden particularly on IT staff. It meant that a lot of them had to attend campus and have that added anxiety. This is during the lockdown period, that added anxiety about risk of infection for themselves and their families. But there was also an additional burden for administrative staff, because the whole way that the background machinery of schools and departments within universities and colleges had to run had to change in a lot of cases from things that were paper based to online, and I think our members responded fantastically to that. Teaching staff did as well, but that would have been impossible without the contribution of people that are represented by UNISON in colleges and universities.
And do you think those efforts have been adequately recognised?
I don't think so. I mean, it's covered in other bits of the evidence, but those people who were at higher risk of infection, those people who had to particularly exert themselves to keep the show on the road, they still haven't had any commensurate improvement in their pay terms and conditions, and in some cases they've had to get into really bitter sustained industrial conflict to just keep what they had before the pandemic. So no, I don't think those people have had any real compensation for the additional contribution that they made during that time of crisis.
Thank you. You talk about keeping the show on the road, which leads me on, I think, to mental health for the members that you represent. Did the impacts, anxieties that we talked about, were you made aware of an impact upon their mental health during that period?
Absolutely, absolutely. And as a representative of staff, I want to be really careful in the evidence that I give, that I'm not in any way seeking to minimise the toll on the mental health of students, but we have to be careful that the toll on the mental health of staff is not forgotten and is properly recognised and properly considered in terms of lessons learned and how any government response is organised, sectoral response is organised if there is a next time.
I think at paragraph 37 of your statement, you pinpoint a particular moment of anxiety. I think you say when the number of COVID-19 cases in Scotland was near zero, but there was an explosion of positive cases in halls of residence. Was that impact mental health acutely felt at that time?
Absolutely. So summer 2020, and it's a kind of difficult time to cast your mind back to, but where Scotland actually was down to zero or near zero cases for a sustained period of time. The first big uptick in cases was in university halls of residence, whenever large numbers of students travelled from different parts of the UK and also travelled internationally and were mixing in a way that they wouldn't have during the prior lockdown period, and the explosive rise in infections in several halls of residence that just created such intense anxiety amongst the type of staff that worked there. So we were able to negotiate successfully for extensive health and safety mitigation measures, but that absolutely did not happen automatically. So steps were taken, but it was after detailed negotiation at a national and a local level. But the anxiety and the disaffection amongst those staff was enormous at that time. Yeah.
And for those members then, during the pandemic, were they able to access mental health support that they might need?
Absolutely, absolutely. But I'm sure there'll be some overlap with the evidence given by student representatives and likely by employer representatives as well, that the resource to meet the need wasn't there. And I'd argue strongly that it's about cutting off that anxiety and that risk at the source as much as it is about trying to treat the anxiety and the fear down the line. So the institutions that really demonstrably did all they could to protect the health and safety of staff and to clearly prioritise that would have had less people needing to access those types of services around staff mental health.
I think in paragraph 36, as you said already, that the mental health of staff should not be forgotten. I think you make the point that the needs of staff and students are not mutually exclusive, I think is the way that you put it.
Absolutely. These people work and learn alongside each other, so having a mental health crisis among students or staff is something that's going to seriously impact on the other group. So we want to emphasise as trade unionists in the sector that the crisis in student mental health is something that we'll have to reflect really seriously on in terms of lessons learned, but we don't want the experience of staff to be lost in that.
In terms of disproportionate impacts then, I think paragraph 24 onwards of your statement, you highlight, I think, a few categories or cohorts of those who are disproportionately impacted, starting firstly, I think, with women. You said UNISON was acutely aware of those particular impacts. How was UNISON being made aware of those at that time?
So as an organisation, obviously we would have been constantly comparing notes across sectors to capture as accurate a picture as we could of what was happening in the country. You would have reports coming up from the shop floor, individual or collective situations where these risks were clearly identified, getting discussed, getting challenged locally and nationally, but also getting discussed within the union structures. But you would also have the research arm of the union in London and in Glasgow working to establish, as I covered before, the international best practice, the emerging evidence, and trying to combine that knowledge in a way that would be a basis for effective negotiation at all levels to protect people. So it was very, very clear from early on that the pandemic was impacting particularly on women, on people from impoverished backgrounds, people in poor housing conditions, people who were, black and minority ethnic members of staff. It became, horribly clear to UNISON early on that they were dying and getting affected in greater numbers. So all of that type of information getting gathered in absolutely informed the way that we went around representing the interests of staff and fighting to get proper best practice mitigation put in place on a consistent basis.
Thank you. At paragraph 28, I think you highlight cleaning staff, for example, in student residences and academic buildings in particular. Why would you highlight them as being disproportionately impacted?
I think it was to take a particular example where you would have a workforce that was not just in the absence of mitigation, a workforce that would have been in more day-to-day contact with large groups of students, where there would have been already that disproportionate impact in terms of, for more impoverished parts of Scotland, potentially being in worse housing conditions, potentially more crowded housing conditions, maybe having other people in their family who are disproportionately more clinically vulnerable or who had disabilities that would be impacted by COVID-19 in worse ways. Disproportionately older workforce as well. So I think it's really important, and we might return to this, it's really important to capture a bit of nuance in this evidence that risk was absolutely there. There was a clear social gradient to that risk, but UNISON and other trade unions were successful in putting in place with employers extensive health and safety and mitigation measures so that we got to a position where we didn't see that differential impact in terms of deaths, serious illness due to workplace infections. So I just want to make that clear, because it might seem to the inquiry like a bit of a gap in the evidence. If you had this clear social gradient of risk, why are you not producing evidence of deaths and serious illnesses? It's because there was an awful lot of hard work done at a Scottish Government level and at an employer level and within the trade union and within discussions between the trade unions to fight for those mitigation measures to be put in place, and that again absolutely shouldn't be forgotten in terms of lessons learned. I think there's a risk sometimes that some of these more positive stories in terms of effective mitigation are forgotten in terms of the detail of what had to be done and how intensely some people had to argue for these things to be put in place, especially on a consistent basis. And we shouldn't think, if there is a next time, that those things happen automatically, or just that we won't have that clear social gradient in terms of serious illness and death, not just amongst the workers but reverberating through their families and through their communities, happen in a way that thankfully we didn't see in higher education and further education in terms of this workforce. Is that clear in terms of
it? It is, yeah. And you obviously read my notes, because that's exactly where I was going next. So that's fine, because I think, as you just pointed out, I think at paragraph 21 of your statement, in terms of known cases, I think you say there that whether it's in terms of illness or death, you weren't aware of those, and you've just given the clarification. I think in paragraph 23, I think you give the emphasis that didn't happen naturally or by itself.
And I think there's a risk there that when there is discussion of how to respond to the next time, that there's a position taken that, well, there was no death amongst these workers, there was no serious illness due to workplace infection, so when we look at the balance of harms, maybe we could push the envelope a bit more in terms of contact between these frontline members of staff, the services that they operate still open, maybe having less of a precautionary close first and assess the situation approach. I think that would be reckless, deeply reckless, if that was the approach taken with a new pandemic, because that would be gambling with the lives of the members that we represent in those sectors and their families and their communities. So the importance of just remembering the detailed mitigations that had to be put in place and the extensive efforts that had to be made to achieve that, and to make sure that no deaths and no serious illness due to workplace infection is not seen as license to change practice next time, but is seen as a serious achievement, a major achievement that people should be proud of.
And those mitigations that you mentioned, are there any particular ones, key ones that you would highlight to the inquiry?
So there's a lot that you would put in place before getting the PPE. So actually trying to remove, at no detriment, people who were not just shielding, but people who were clearly clinically vulnerable or who had clinically vulnerable family from the workforce wherever possible, putting in place other work arrangements or furloughing them so that they didn't attract that risk, changing work responsibilities so people were able to social distance in a way that was much more safe and much more effective than consistently working at close quarters with masks of a poor quality, making sure that, and I think we may cover this later on, making sure that people have proper full pay sick pay so that they aren't incentivised to attend work for fear of poverty, for fear of hardship, and potentially spreading a viral infection that could potentially cost lives or cost people in terms of serious illness. So there's a long list of different mitigating measures that we were able to fight for, and that was the material work that achieved no deaths, no serious illness amongst this group of workers on university and college campuses in Scotland.
And you continue to mind read, because I'm going to move on now to outsourced workers, which is
Apologies.
something no, not at all. That's what we're here for. In paragraph 30, you raise the issue of outsourcing, and I think you say that it's much more prevalent in colleges than in universities. And you say that outsourced staff were seriously impacted during the pandemic and left in a particularly vulnerable position. And I think in that paragraph you say that private companies were ignorant of the Scottish Government's message on fair work. For those, just to start with, who might not understand what that message on fair work is, could you, in a nutshell, encapsulate what that means?
So for a number of years now, and including before the pandemic, the Scottish Government has had a fair work framework that encourages public sector employers in Scotland, but also organisations that are principally funded by the Scottish Government, to take a series of steps to ensure fair treatment at work. So this isn't law, this isn't statute, that is quite general guidance. But if you're going to achieve the basics of fair work, that's much more difficult in an outsourced catering firm or cleaning firm, particularly in a time of crisis like then, because they will not have the same collective bargaining arrangements. They will not have the same arrangements that allow for the recruitment and training and resourcing of trade union representatives. They will generally not have proper sick pay arrangements. They'll only have statutory sick pay. So you have lesser terms and conditions in terms of that two-tier workforce. You almost certainly have less stringent health and safety procedures, and you also don't have the same apparatus of trade union representatives. So you've got a range of different factors that put those people more at risk of hardship and more at risk of infection in a crisis situation like that.
And is that why then at paragraph 31, I think you talk about a two-tier workforce? I think you've just explained
Absolutely.
why that is.
Absolutely. And I think it's important to emphasise how that creates wider risks. So when we're making the arguments around that at, say, Queen Margaret University, where the cleaning staff are outsourced, we made very strong representations that this wasn't just about excuse me, I've got a chest infection, so when we're making representations around this issue to the Scottish Government and to the employer, it wasn't only about the hardship that people would face if they were having to take time off with COVID-19 or with any other illness. It wasn't just about the risk of infection to their colleagues and their families, where people were incentivised to come onto the campus. It was also the fact that needlessly, arbitrarily created risk for other staff and students accessing the building for an amount of money that's basically trivial in terms of the overall resources of these organisations. Making sure that there's proper sick pay in place is just an absolutely crucial public health measure, and that applies outside of pandemic conditions as well, I'd strongly argue.
And you mentioned making representations to the Scottish Government on this. What do you consider that the Scottish Government could or should do differently in this respect if there was another pandemic?
I think the most consequential thing the Scottish Government could do on this issue is to eliminate the two-tier workforce within these organisations, to use a relatively small amount of public money to ensure that everybody that provides services within these buildings is employed directly and has a common set of terms and conditions. So that would be a relatively small number of low-paid staff in cleaning roles and catering roles at a number of colleges and a very small number of universities, being in a position where they know that if they have an infection or serious illness, that they don't have to worry about their pay, that they'll actually have fair, consistent treatment compared with the other people that are working in the same building. So I think it would be an easier answer to say we'll tweak the guidance next time on that, but I want to emphasise that earlier point that because most of these employers don't properly recognise trade unions or don't properly engage with trade unions, definitely not the extent that the overarching employers do, the colleges and the universities, that wouldn't be an efficient step to take. It would be much better to be bold and eliminate the two-tier workforce for fairness reasons, but also for prudent public health reasons if we see a repeat of the pandemic.
Thank you. I want to move on then to the reopening of institutions. At paragraph 44 of your statement, you speak of a clear disparity between lower paid manual workers on campus and teaching staff as campuses reopened. Could you elaborate on what you mean by that clear disparity?
So that's almost the reverse dynamic to what we would have seen in March 2020. So in the same way that more autonomous professional staff and teaching staff, lecturing staff began to remove themselves from campuses at an earlier point in March 2020, and the return to campus, those same groups of staff had a lot more scope to quietly resist the return to campus or not return to campus at all. So when front-facing library staff, cleaners, porters, security officers were returning to campus in greater numbers, maybe they were taken off furlough, or maybe there was some changes in the classification of who would remain at home due to a clinical vulnerability of the staff member or those at home. It was really obvious and keenly felt by those members of staff that they were there but others weren't, and there was a real sense of injustice around that. So, as has been covered before, we still argued successfully for extensive mitigating health and safety measures to be put in place. So even at that time, excuse me, because those measures were put in place in one, again, we didn't see workplace infections generating serious illness or death, but there was certainly that sense of injustice that you referred to.
And these mitigations again that you mentioned, those are things that you would expect in the event of another pandemic would be put in place.
Absolutely. Yeah.
Thank you. At paragraph 45 of your statement, you mention that adherence to public health guidance began to break down, I think you say, in the latter half of 2020. And you give an example in there, I think, in that paragraph. How did that impact upon the members that you represent in their frontline support roles?
Well, I know you've had really compelling evidence to this inquiry about just how horrendous it was to be a student in those circumstances at that time in those halls of residence where there was that explosive rise in COVID-19 infections. So nothing UNISON is saying and giving this evidence is intended to take away from that experience at all or diminish it, but some of the behaviours were unfortunately outrageous that our members faced. So to take Paula Collins at the University of Edinburgh, having in those circumstances with that huge sense of fear and anxiety, having just achieved the position of basically zero COVID in Scotland, suddenly there were these clusters of hundreds and hundreds of cases concentrated in these areas, and you had some students in extremely difficult circumstances, that's absolutely acknowledged, throwing COVID parties, deliberately trying to get infected, to sort of get through it, to get over it, and in a smaller number of cases, antisocial behaviour around parties that would have had to have been broken up just to try and enforce those public health measures. A smaller number of cases where people were, abusive to staff or even spitting at them. So this is very, very small numbers, absolutely not representative of the student population, but that caused huge, huge anxiety amongst the staff that had to deal with those types of situations. And there was huge anger that, as far as we could see, those students weren't being punished by the university, and there absolutely wasn't, any sort of parallel enforcement action being taken by the police. So I have to be really careful to say that we didn't want a scenario when we said this at the time, where students were being criminalised or where students were facing an authoritarian response or being stigmatised. But in those extreme cases where people had people in their own homes to go back to who were clinically vulnerable at a time before vaccination or widespread vaccination, that was a horrendous situation that generated huge anger and huge frustration amongst our members and amongst our representatives.
Thank you. I want to move on briefly just to guidance. It's something that you mention at paragraph 35 of your statement. You mention, I think, a particular frustration in relation to that. I would just ask if you could elaborate on what that frustration with the guidance issued by the Scottish Government was.
So that's in situations where somebody is a member of staff and they're a student. So we had circumstances where you had guidance that applied to students demanding that people remained indoors or didn't mix, but we had people who were also members that worked in catering or hospitality roles where they were subject to a whole other set of public health rules, and you would have that fear about, am I going to be arrested, am I going to be punished, am I going to be shamed for what I'm doing. Both these sets of rules apply to me at the same time, so government officials and the other groups that were working on the guidance were under tremendous pressure to come up with evolving guidance that addressed the public health situation and that was practical in real life. I don't intend to take away from the difficulty of that task, but you can just imagine if you're subjected to entirely different sets of stringent rules, it's not a pleasant position to be in. So that was something that did generate frustration for a small but significant number of our members.
So there's a nuance or distinction that perhaps that wasn't understood in that guidance at that time.
Staff can be students as well, including at other campuses. Yeah.
And that could be improved upon.
Absolutely.
Thank you. Wanted to finish then with lessons to be learned. You have a section in your statement regarding that, and at paragraph 54, you say there is no room for complacency if there is another pandemic. UNISON worries that in the event of another pandemic, the Scottish Government would go too far in supporting students at the cost of support to frontline staff. What's the reason or reasons for that worry?
I think there are a number of factors behind that. So the severity of what we've seen in terms of impact around lost learning, in terms of student mental health, it's completely understandable that would drive a lot of lessons learned that would intend to minimise that. But in practical terms, that would mean keeping more services open more of the time in a new acute pandemic situation, and that would involve more front-facing staff being present in buildings to deliver those services and to clean and maintain buildings, and that would come at a risk to the life and the long-term health of the members that we represent in universities and colleges. So we just want to urge the inquiry, and we want to urge the Scottish Government to guard against any type of complacency around that. I mean, the public health situation, even before the pandemic, was stark in Scotland. It's worse now in terms of the huge gap in life expectancy and healthy life expectancy between the top 20% of income communities in terms of income and the bottom 20% of communities based on income in Scotland. I think that's according to the National Records of Scotland, that's almost 25 years for women in Scotland now, and that those statistics encompass those type of differentials you see in a university between the university principal and the university cleaner, between the person who works as the security officer and the person who works as the research professor. And if we're wanting to see, and this is certainly something that UNISON wants to see, bold action to end those health inequalities that we know were horribly accelerated by the pandemic, horribly intensified by the pandemic, and almost certainly would be horribly intensified by a repeat of the pandemic. We need to make sure that we are building on the best practice from last time in terms of the detailed, extensive mitigations were put in place, the measures that were put in place to protect the lives and to protect the long-term health of the people that deliver those types of services. A different pandemic, a different virus would have completely different dimensions, and that's what makes it, especially important that there's that consistent, precautionary, prudent approach taken to minimise risk until proper assessments are made of what can be done to deliver a safe workplace and a safe learning environment. And if we were to contrast the COVID-19 pandemic with, say, something like the Spanish flu from just after the First World War, that impacted much more seriously on young people, healthy young people, compared to people that were more clinically vulnerable, tended to be older. And taking that consistent, precautionary, prudent approach, learning lessons from what generally served our members well last time, that could end up protecting students next time even more than it protects staff. We shouldn't think in learning lessons from the pandemic that we've just experienced. The next one will have exactly the same dimensions or exactly the same risks. So that's why we are just wanting to emphasise as much as possible today that the contribution of those support services staff, those professional services staff, is recognised, that the particular risks to those staff are remembered and are taken into account, that the representatives, and that means UNISON, Unite, of those staff are at the table and involved in genuinely detailed discussions about plans for what would be done to deliver safe, prudent operations in the event of something like this happening again. That's what we're calling for. And just to go back to the first point in this argument, we would worry that a lot of that hard work, detailed work, would be glossed over by just saying balance of harms, because I get the sense from having been in many of those discussions, as we saw adherence to public health measures waning and universities increasingly breaking with Scottish Government advice, guidance towards the end of the pandemic phase, I get the sense that some university and college leaders would be keen to take more risks with our members. They would say to reduce some of the harms to students, but we just don't want the detail of that work to be forgotten, and how important it is to have the representatives of those staff at the table right from the start, making sure that they're part of those detailed arguments, so that there is that proper flow of information from the shop floor right the way up to discussions at a government level, at a university principal level, college principal level.
Thank you. My Lord, I don't have any further questions to ask this witness, subject to anything that you wish to ask or add.
Nope, I've got nothing I wish to ask or add. That's all. Thank you very much, Mr. Mullen, and we'll come back at 2 o'clock. Thank you.
Thank you, my Lord.